How do you sort out, go about sort of programming or making editorial decisions about what to cover?
So there's a couple different things that we look at. We had something that we created called the Green Grid, which took a lot of inputs in it in terms of SEO, what's trending in the news and in our news media base. And then it comes down to from our own clinical experience also in terms of what we are seeing as physicians, because we also have a medical advisory board, and then myself seeing what really is needed out there. One of the unique things about our content is what you had just were describing, is that there's so many different aspects of health, and there's caregivers, there's actual patients, and then family members that that are diagnosed and you want to learn more about. So we have the breadth of content. We really, no matter where you are in your journey of health, so we have content that we make sure you have, say you turned 40 and you want to know, when do I get a mammogram? We have that type of content. Then we also have content, I have stage 4 lung cancer. What's the newest cutting edge treatment out there for immunotherapy? So we have content on that. And then one of the biggest things that I also have pushed our editorial process and making sure we do is what I've seen in my own practice, where patients are diagnosed with certain conditions and they don't know how to live with it. So we have the content already in our library of what is diabetes and how to manage in the treatments, but then like, how do you actually go about living with diabetes? So just recently we just shot with our nutritionist going to an Italian restaurant. How do you go to an Italian restaurant as a diabetic and order there? How do you look at a menu? What are the things you should look at? So doing that in our nutrition. In our fitness content, we started doing yoga for stressful and mindfulness, and also for people who may not be ready to do full-on aerobic exercises and need to ease into other types of exercises. So we make sure we have the gamut and the range of health content. So when we're deciding, we really make sure that we hit all of our buckets for a person in their health journey, that we have not just preventive, but also how to live with the condition, and then also more of late stages condition content, that they're looking for more cutting edge treatments.
What is your approach to sorting out what is real and making sure that it's real?
So that's a great question. So that is what I pride myself on in our company about, and that's what UREC accreditation has also seen our process. We have a very strict process in terms of what we publish and what sources that we use. So I actually have created a database for my editorial team of what sources are considered legitimate and accurate sources. So such things as the National Institute of Medicine, CDC, all of the medical institutions like American Academy of Pediatrics, those professional societies. So when we go and look up, when we're doing a condition content, we use those databases and those sources. And if I see a source pulled that I don't think is a legitimate source, we don't use it. So we have very strict guidelines on what we use. And there's also a great database that physicians use called UpToDate, which is an evidence-based database where you, with all conditions, different doctors have now compiled all the newest evidence and have created one-stop shop for where doctors can really truly trust and go to get the health content. So we use that as another major resource for us. So we're very, very careful on what we use. And one of the other things that we do in all of our videos, you can actually see what sources that we've used. So one of the other URAC requirements is that we disclose which doctors have reviewed the videos and also what sources that we have used, so there's complete transparency. And if a consumer, which has happened, has emailed us questioning some of our claims, we're ready there to back it up and show where we've got the data. So we have a very strict editorial policy on where we find our sources.
What's the power of video in communicating this information?
I think one of the biggest things is health literacy, and there's been a lot of research done on health literacy. And in terms of reading something, one of the things is that making sure that a patient actually comprehends what they're reading. And what they found is that images actually help to reinforce some of the data, because it can get really confusing reading a whole article about diabetes and sorting out what's important and what's not. And also, a lot of people only have up to an 8th grade literacy level. And having what our videos do, it enables them, we actually have bullet points to reinforce any like diagnostic tests or treatments that we talk about, we follow health literacy rules. So we show them an image, they hear it, and then they also see it written, like the high bullet points. So we have 3 ways of reinforcing the same message. One of the great videos example that I like to show is we have a video on how to give your child medication. And a lot of people are like, oh, you just give a teaspoon. But actually, we showed them a teaspoon is not as accurate as using a medicine cup. Because when you actually measure out the 5 mLs that like an ibuprofen or acetaminophen is, the dosing is, and you just use a teaspoon, you actually may get more than 5 mLs. So how important it is to actually use the proper devices when giving medication. And the only way to really relay that is by seeing it. And that's why I think the power of video is so important. And one of the other areas that we do is a lot of patient stories. And when you hear someone else going through a condition that you're going through and you can relate to them, it's really empowering and it really relays the message of hope and also relatability than just reading about some article about someone who has a diagnosis. So that's why I think video is so important and why a lot of people are really turning to it.